I just wanted to introduce the university, and for those of you who don't know us, we're Buckinghamshire New University. And I always show this slide when I'm talking about the university because of our name. And this is a particular challenge when I'm talking internationally and I say our name is Buckinghamshire New University, and the first question I get is, so how old are you? Are you a new university? So I always have to say we are 100 years old. We've had various iterations. We've been Buckinghamshire College of Higher Education, some of you might remember that. We've been BCUC, Buckinghamshire Chilterns University College, and about 5 years ago we became Buckinghamshire New University. And the reason for the new is that we are new as in a university that is outward facing, a new generation university that's outward facing, working with businesses, working with the public sector, working with local authorities and our NHS partners. So that's the new in Buckinghamshire University. You'll know where we are. We're in High Wycombe, and that's our brand new building. I say brand new, it must be 2 years old now. The Blue Gateway building, fantastic facilities that we have there, and it's here that we have our centre that Firas is going to be talking about, and I'm going to be introducing. We are outward focused, and we have got a number of institutes and centres that help us to work with our business partners and with our public sector partners. We have an enterprise function that has supported the development of CETAL, which is the Centre for Excellence in Telehealth and Assisted Living, and Firas is our director. And what we do is that we as CETAL offer what we have here in terms of research, in terms of workforce development, working with businesses, commissioned project work. And we have developed CETAL over the last 3 years with our partners, very firm partners that we've been working with. That's Bucks County Council, that's Aylesbury Vale District Council and Stoke Mandeville. And we're absolutely delighted to be working with them in the development of CETAL. I think I've probably said enough, and so I'm going to pass you over to Firas, who's going to talk about what we've been doing in CETAL with our partners and some of our projects.
Okay, thank you very much. Good afternoon everyone, and thank you for staying for the presentation. I'm sure all of you are aware of the whole system demonstrator. I'm sure all of you are aware of the government drive to implement or to use technology within healthcare service and with the delivery of healthcare. And you know that the whole system demonstrator was the biggest in Europe, and there was about 6,000 plus patients being recruited in 3 different areas within the UK, in Newham, in Cornwall, and I believe in Kent. And really the whole focus of the whole system demonstrator is really to look at how this technology could help patients to have a control over their life and to maintain a good quality of life, and really to stay longer away from the hospitals and so on. And really when they evaluated these projects, they looked at certain elements in terms of the cost effectiveness of that technology, the clinical effectiveness, organizational issue, and also looking at how that will affect the carers and also the healthcare providers for implementing telehealth or telecare within the system or within their organization. And all of us really remember the big word if. They mentioned there about if telehealth implemented correctly within the healthcare system, therefore we'll be able to have a reduction of about 15% of accident emergency visit, 20% of emergency admissions, 14% of actual reduction in sort of readmissions into the hospitals, and so on. And really they went on, from there they moved into the concept of Dallas, and then the 3 Million Life campaign and so on. And really meanwhile, while that really going in the background, we are within the IST project, which is launched in 2009 by CETA. Really Aylesbury selected as one of the key areas to actually look at how technology could be used to actually help individuals with either vulnerable adults who's having either physical or mental disability. And really we've been working extremely closely with Stoke Mandeville Hospital, with Bucks County Council, with Aylesbury Vale district to see, trying really to shape the future of how we can bring that technology into Buckinghamshire in the most effective and structured way that will ensure collaboration and partnership with actual organizations that we want them to be involved. And again, I think all presentations from the morning till now, they all spoke about we want to have partnership, we want to have collaboration, we want to have about establishing consortia, and really the whole thing is, yes, we want to establish consortia, but at the same time we need to ensure is that whatever product, whatever system, whatever model that we are developing as professionals, as a private industry, as healthcare professionals, is that to be fit for purpose, fit for practice. So if I choose a product in terms of that dementia spinal cord injured patient with a pressure ulcers or with autonomic dysreflexia, I really want to choose a device that's really to be, or a system that will meet the need of these individuals to ensure their safety and also to ensure them having that quality of life away from the hospital to lead a normal life at the same time to reintegrate back into the society and really rejoin the society again in terms of production and so on. And in terms of the functions of the CETAL is really one of the key functions about research or looking at evaluation of actual projects. We've been heavily involved with Bucks County Council and so far we have up to 4 projects that have been undertaken or under evaluation within the county, and these projects really looking at medication compliance, looking at telemonitoring for patients with heart failure or with chronic obstructive airway disease, and also looking at smoke cessation is another project we are looking at, and also we were looking at sort of health promotion in terms of sexual health and so on as an element of behavioral change, how technology could contribute to these individual life and style of living. Again, in order to establish that effective partnership and collaboration with the key parties within the county, I mean whether Stoke Mandeville or Bucks County Council or Aylesbury Vale, is really to look at, for each project that we've done, we have a committee or we have a project really group, and really this present industry, present patient and end users, present commissioners, and also us as an academia, really, and healthcare professionals are actually going to be use these equipment and these systems to ensure that whatever we are evaluating is really being measured against already established either guidelines or protocols or a set of framework that the actual health, let's say Bucks Health Authority, that they want to achieve through implementing these schemes. In terms of consultancy, it's really about, within the university, we are quite well established in terms of having a well-structured research infrastructure, and that infrastructure really provide a governance to actual conducting research in terms of protecting patient rights, in terms of protecting industry and so on, in order really to be able to share the outcome of that research and be able to disseminate it in the most effective way. Again, as a university, we are offering the partnership that we have within our health, let us say the contract that we have with the hospitals, either within London or within Buckinghamshire, to a wide range of specialities that they could benefit from developing these concepts of relationship, establishing relationship in terms of developing joint projects, developing joint accredited courses that really tailor to meet the needs of these local hospitals or within the county or beyond the county. In terms of evaluation, as I said earlier on, we are involved in evaluating four projects so far, and we are involved in a 5th project in Berkshire, really looking about the automated response for chronic obstructive airway disease. And again, when we are evaluating, we're looking at the 3 elements really, looking at the service, is it making any difference to what we have now in terms of is it meeting its objectives, its aims and so on, looking at the patient experience. Are they finding that, is it acceptable to them, this technology? Is it effective? Is it efficient? Is it really meeting its aims and so on? And really looking at the staff, because we as healthcare professionals, we like to have contact with our patient. How do we feel about being away from the patient, monitoring them from a distance? And again, really that have a huge implication in terms of the legal and ethical issue of offering an advice to the patient from a distance. Other issues we're looking in terms of the quality the quality of care is being delivered, the quality of the technical service in terms of the actual device itself. Is it working, not working? Is Is it easy to use? Is it meeting what's its function, and so on? And also looking at the financial impact. Is this using these pieces of equipment? Is it saving the NHS or the healthcare providers anything? And again, we have really been working heavily in the last few months with the stakeholders within Buckinghamshire, with Stoke Mandeville, with Bucks County Council, really looking at developing really specific modules that meet the need of the workforce that we are dealing with. And that's specifically looking at the telehealth, telecare, assisted living modules, really to be specific in terms of trying to understand the implication and the application of that technology into specific conditions, looking how we can evaluate these technologies into the system and how it's actually making a difference to the individual life. And again, looking at a group of patients, looking at a group of individuals that we need to be addressing this as a group, how we can do it and how we can develop it by bringing in the private industry or the SMEs, the other councils, and really to share the experiences with them and have more practical seminars to how these equipment could be used and could be utilized for the patient's benefit. And finally, it's like a lot of these issues probably been mentioned this morning. Wherever we go, there is a need for training, there is a need for education, there's a need for development of the staff, because all of that is really new technology. All of that is a new concept to the healthcare providers. Alison this morning spoke, the director of the spinal spoke about, yes, we want everything, but there is a gap between us and what we want to achieve. And I think, personally, I feel part of that is really looking at the training, how we can change the mentality of these individuals, rather than having that physical contact or physical touch with the patient, by using this technology, being able to access these individuals. Again, we have show sites or show flats. Within Buckinghamshire, we have one in Aylesbury, one in High Wycombe. I think we need to use these more effectively and more efficiently to bring more people into it and really have a feel of what these equipments might do and what could be achievable, not achievable. Again, to all of that, we're good to have a vision. We're good to have really very clear vision to where we want to be within the next 5 years. What is our target for the next 5 years? And really to be able to be precise and really to actually set short goals to actually what we want to achieve and take it step by step. Telehealth is a huge field, and as you say this morning, a lot of telecare has been implemented, but in terms of telehealth, it's still new to the actual health service. It's still new to a lot of the clinicians who might resist it in a big way. And again, we need to establish governance. Whatever we do, whatever we produce, that it's been validated, that it's reliable, that it's evidence-based, that it's been agreed by certain, I would say, professional bodies, whether it's nursing or physios or occupational therapists or medical staff, to ensure that whatever system we produce is actually evidence-based. And that could be subject to change in a year's time, 2 years' time, providing whatever guidelines or protocols being set within the healthcare field. And again, the concept of, I'm a strong believer of actually sharing information and being transparent about this information, because this information is going to produce knowledge, and that knowledge will actually help these individuals who might require the effective system and efficient system of telehealth. And again, it is really, there is no journey start without obstacles. And this really is really my personal perspective is, any journey you started is you need to have that first mile. Once you achieve that first mile, which you are nearly there, hopefully things will become more clearer to the next mile and third mile and so on until we actually reach our goal. And our goal is really to see telehealth is used as an effective, efficient way of delivering care as long as we're providing quality of care for our patients. And thank you.